Hey, Robert. I was going to write you, but then I decided instead to make a movie for you. Because, it's kind of fun these days to watch movies rather than read anything. It's boring. Reading is kind of boring, I think. So uh, I am going to try to um, prove to you somehow that pain is not caused by tissue damage or um, like vertebrae that are out of alignment or disc bulging or these types of things. So I'm actually going to try to make an argument that that's not the cause of pain, which I know is like crazy from the face of it, because from when we first start moving around, if we stub our toe or skin our knee, we have an owie there and it hurts right where we skinned it. And so it seems totally obvious that the pain comes from where we got the injury. Like it seems stupid to argue that that's not true. So if you feel pain in your back or if you feel pain in your neck, like I did for 30 years, naturally you think that there's something wrong with your back or your neck. It's perfectly, it's not even logical. It's like, it's so obvious that it's beyond logic. It's just like, it seems just obviously true. So I'm going to argue against that. So I need to, to have, come up with a reasonable argument, which is what I'm going to try to do. That's all. Like I can't hope to convince you necessarily one way or the other, but I'm just gonna present a case, see what you think. One thing is, as you know, and that any of your doctors, like your famous or your friend, who's a back doctor or a spine surgeon or any of these folks, they're all going to tell you that it's very hard to say whether surgery is going to be effective or not. It's just, people have surgeries and sometimes they get relief and sometimes they don't. And, it's 50-50 chance or, 70% chance or, they don't really know. And also the same thing with physical therapy and chiropractic and on all the rest. Sometimes people are benefited, sometimes they're not. Sometimes it lasts for some time and then it's gone. People like you and me and, a billion other people more who have chronic pain or back pain or neck pain or whatever the chronic health situation is. We wouldn't have those situations if we had a cure. And that's just the truth. Like if medicine right now knew how to fix those things, then they would have already done it. It would have been, and if drugs fixed it, then we could just take a drug and we'd be fine. But but it hasn't worked. So that's already a clue that maybe that situation is being looked at in the wrong way. One set of facts that would argue it against. We can just talk about, there's a lot of different types of pain. And we can just talk about the pain that we think is coming from the spine, like back pain, lower back pain, or cervical pain. We think naturally that there's something wrong with the disc there or the vertebrae. Something's going on, there. And we get pictures, MRI pictures, and we see that there's a bulge here or that the spine is too straight when it should be bent, or there's something out of the ordinary, with it. And if somebody has pain and then they look at their spine and they see, a doctor sees something there, then it would be reasonable. It has seemed to have been reasonable over all these years to say, okay, well, it looks like it's probably must be coming from this because it seems as if this must be putting pressure on the nerve, You know, it looks like we found a cause. We found a physical cause for a physical complaint. And the problem with that is that, there have been, it's been studied basically. For example, it's been studied. The people, physicians have looked at people who have no pain at all, and looked at their MRIs to see whether they have problems with their, with their discs, and it turns out they do. This study, I think there's 100 people in this study. There's many of them, but I just picked one. I'm not sure which one this is actually, but anyway, it makes the point. Like 64% in this one particular study, 64% of people who have no back pain whatsoever have all kinds of issues with their spine. Disc degeneration, disc signal loss, height loss, disc bulges, protrusions, annular fissure, facet degeneration, spondylolisthesis. No, I don't know how to pronounce that. Spondylolisthesis. And one thing that's been seen is that as people get older, like this is ages, 20, 30, 40, 50, 60, here's you 70, congratulations, 80, the tendency to have these issues with the back increases. But just because, these are all people that don't have any pain. So just because you have problems, so-called problems, we think they're problems. We think they're problems because we think that they cause the pain. But just because you have these age-related differences in your spine doesn't mean you have pain. Because none of these people have pain, even though they have a problem, seem to have an issue with their back. I'm trying to think of his name, skipping, not thinking about it at the moment, but there's a famous physician working in this area says that these types of things it's like gray hair for the spine. When you get older, your hair gets gray, turns white. These are age-related problems, but it doesn't mean you don't have pain because you have gray hair. You don't have to have pain from these things. That may seem insane. Like it may seem that if there is something touching the nerve or putting pressure, on something in the spine, or if the MRI looks weird or something, it seems like, well, that must be causing some problem. But what's actually going on there is an incomplete understanding at best of what pain actually is. And what pain is a signal. It's a signal to the animal, in this case you or me, that it's in danger and its behavior needs to change. Like an animal that just broke its leg needs to stop walking on that for some period of time. So the pain steers the animal away from an activity that would damage it. And it's a signal that is sent to the conscious animal, you could say, by the brain to steer its behavior. It doesn't, and it has to do with danger. It's a signal about danger. There is no direct correspondence between that signal and damage in the body. And I'll show this. There's a well-known, he's a neurobiologist, I think. I'm not exactly sure what his PhD is in, but his name's Lorimer Moseley. He's from Australia. And I'm gonna go through this with you because it's really quite good. And this, I think, will really clarify what it means to say that the pain is not caused by tissue damage or by what's happening at the site, but it's actually caused by what the brain is interpreting is going on. Guy's funny too, which is kind of cool.
As everyone goes, great, quick nap. Don't have a nap. Raise your hand, just squeeze your left ear as hard as you can. Raise your hand if it hurt. Fantastic. Thanks for having me. No, that's not true. Let me tell you a story. I just want to take that off the screen for the moment. I want to tell you a story that will explain to you the first 3 years of the neurobiology of pain that you would study at university. 8 years ago, I was walking in the bush. I had a sarong on. Very cool. This is what happened. Did you see that? Hang on. This is what happened. Biologically, I'm going to tell you what happened just then. Something touched the outside of my left leg in the skin. That activates receptors on the end of big, fat, myelinated, fast-conducting nerve fibres. And they stream straight up my leg, straight into my spinal cord, up to this part of my brain. And they say, you've just been touched on the outside of your left leg in the skin. Meanwhile, whatever it was is sufficiently intense to activate free nerve endings. We call them nociceptors. They're thin, unmyelinated, slow-conducting Lada neva. Someone knows what a Lada neva is. Nerve fibres, and that message travels up to my spinal cord, and it gets to my spinal cord, and that's as far as it goes. And it says to a fresh neuron in my spinal cord, you've just been, something dangerous has happened on the outside of your left leg in the skin, mate. And the spinal nociceptor takes that message up to the thalamus, which sits in there somewhere, and says, there's danger on the outside of your left leg in the skin, mate. Now the brain has to evaluate how dangerous this really is. So it looks at everything. And the way that I make sense of this, of what happened to me, is the brain thought, frontal lobe, have we been anywhere like this before? Hang on, I'll just ask the posterior parietal cortex. Have we been in this environment before? Yes, we have. Has it happened at this stage of the gait cycle? Yes, it has. Is it coming from the same location? Yes, it is. What is it? Well, your whole life growing up, you used to scratch your legs on twigs. This is not dangerous. I'm going to give you, the organism, just something so you can kick off the twig and continue on your merry way. And that's what happened for me. I can't show you now, but I took off my...
And I just wanted to underline here that what he's saying is that the brain didn't just look at what was happening there, but in order to assess what was going on, it touched on memory too. So sensations are constantly flooding into the brain to be interpreted. And whether something is good, bad, the meaning of it depends on the history that we have. So what it's saying is that nothing is automatically good or bad, painful or not to the brain, to our experience. There's learned behavior going on here.
The wrong, got in the river, got out of the river, and that's the last thing I remember, having been bitten by an eastern brown snake. Survivor. Thank you very much.
So just in case you missed it, because I stopped it there. So he was bitten by an eastern brown snake, one of the most poisonous snakes in Australia, and it felt to him like just a twig, on his leg. It should be extremely painful. All he felt was a little scratch.
Now, for some reason, the eastern brown snake works by poisoning you, clearly. And one of the things that it does is activates nerve fibres. So actually, my brain would have got all these messages saying, danger, 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 danger. And in its wisdom, it said, no, 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 no. 6 months later, I'm walking in the bush with a boring talker. You know what a boring talker is? Those people, it doesn't matter what they say, it's boring. That's irrelevant, but we'll call her Naomi, because that is her name. Anyway, this is what happened, right? Oh, whoa! And I am in agony. I have got a white hot poke of pain screaming up my leg. I'll tell you biologically what's happened. Something touched the outside of my left leg in the skin. That activates big fat myelinated nerve fibres, which send a message up to here. Just been touched on the outside of your left leg in the skin. It's sufficiently intense to activate these free nerve endings, danger receptors. Take the message to my spinal cord. Just been something dangerous has happened on the outside of your left leg in the skin. Yes. Well done. You weren't planted. That goes to the thalamus and says the same thing. Something dangerous has just happened on the outside of your left leg in the skin. So the brain says, thanks very much, thalamus. Kids all right? Good. Anyway. Frontal cortex. Anything to tell me about this? Hang on, I'll ask the posterior parietal cortex. Where are we? We're walking in the bush. Oh. You're a bit mate happy. This stage of the gait cycle, where's it coming from? Have we been here before? Oh, yes, we have. Last time we were here, you almost died. I'm going to make this hurt so much that you can do nothing else. And I was in absolute agony for what seemed like minutes, screaming pain, until one of my mates looked at my leg and there's a little scratch from a twig. The pain in those situations was totally different because of meaning. I want to try and convince you that pain is an illusion 100% of the time. Here's a visual illusion.
I just want to pause that. So he just said pain is an illusion 100% of the time. This is a really difficult point for people to accept. And one reason is because I think it's a little overstated. When he says that it's an illusion 100% of the time, it doesn't mean that it doesn't really feel true or real. It feels completely real. He's saying that all pain is similar. All pain is equally made by the brain, and in that way it's like an illusion because it's not coming from the physical place it seems to be coming from. It's actually a signal made by the brain. In that way it's an illusion, but it doesn't at all mean that it's not real or it doesn't feel real. Of course it does. Any pain that we feel feels absolutely real, and it doesn't matter if you call it an illusion or not. It feels completely real. So that shouldn't, that's not to say that we're not feeling what we're feeling.
So if you have a look at this picture, you've got a square that's got A in it and a square that's got B in it. Raise your hand if you think that the square with A in it looks darker than the square with B in it. Thank goodness for that. None of you have a really socially embarrassing neurological disorder, except you. That's not true. But watch what happens if we have another look at this. These are those two squares taken out of that picture. And hopefully you can see that they're identical, and some of you may not believe me, so I'll just put A on top of that, and I'll put B on top of that. And some of you may still not believe me, so why don't we just move A over on top of B, or B over on top of A. No matter how long you look at this, A will look darker than B, because your brain's doing some really groovy stuff, really quickly, outside of your awareness. Have a look at this. Turn your head on the side and have a look at the same picture. Nothing changes. Fantastic, 100% tape. So what really happens here, exactly the same frequency is hitting your retina, and that sends a message to the back of the brain. And then all of this groovy stuff happens very quickly to ask the question, what does this really mean? What's biologically advantageous for me? And then you get a visual image. This is a visual illusion. And vision's not about emotion. Vision's not necessarily about survival, but pain is.
Okay, I want to pause that too. So in this case, you had the same signal, the same frequency of light coming to your brain. And in one case, it made it look light. In another case, it made it look dark. That's analogous to these signals coming from the body. They can come in to the brain. In one case, the brain, if the brain is, let's say that light means it's bad, it's painful, it can make it appear painful. Another situation, dark, it can make it appear not painful. Same sensory information coming in. And in one case, because of how the brain is processing it, it puts out one color, pain, or a different color, just neutral sensation, or even good. Like, for example, sometimes if we enjoy a hot shower or something like that, it can feel absolutely wonderful. Another time that same amount of heat may feel painful, may burn us. It just depends on what the context is and what the brain is making of those sensations. Sensations can be the same, or the underlying sensory information can be the same. The brain puts out a message and interpretation of that information.
Now, some of you might not know if you're not medically trained, but what's happening at this guy's leg, right leg, that's not right. That's
his leg's about
dangerous
falling
situation.
off.
And that danger message arrives at the brain, and the brain has to ask exactly the same question. What does this mean? What
like a Joe Theismann break.
And hopefully, the orchestra in this person's brain will make your leg hurt. In the work that I've been doing for a long time, we're trying our best to work out how.
This example I think is useful also because we know, like, people, if they're running from a burning building, or if someone's at war, they may have an injury that they don't feel until they're in a safe place, because the brain, it's not helpful to the organism to feel that pain at that time. It's much more important to find safety. So the brain puts out the pain signal when it's a meaningful signal about the situation or to guide the animal. If it's not a meaningful signal, in the way it's supposed to work, if it's not a meaningful situation for which the animal should feel that pain, the brain wouldn't put out that signal. What can happen with chronic pain is that basically the signal is not useful, but the way we respond to it sets up a positive feedback loop, which I'll get to later, and which we'll see anyway in these films.
How do we convince people in pain that we understand they're in pain, but it's not just about the tissues of their body? How do we convince them of that? And a key conceptual shift that we think is really important is that you can understand that pain is the end result. Pain's an output of the brain designed to protect you. It's not something that comes from the tissues of your body.
So that's like the first big thing, and I'm just wondering, even as I'm thinking about you watching this, like, what do you think about that? Like, could it be that the pain is not coming from the tissues in the body, but it's coming from the brain? That's like the hard nut to crack, or the basic understanding to come to. If you begin to take that on, then a different way of experiencing what's going on with oneself can happen.
There's nothing there. We show patients a really sharp knife, and we say, this knife is sharp, yeah? Yeah. And it might be a bit cold, yeah? And it's hard. It's got all those properties. Is this knife painful as it sits out there? No, it's not. That knife does not have the properties of pain. And when you stick it into their belly, we do this regularly, straight through. The belly doesn't adopt the property of pain. The brain has to do some very rapid and groovy things to project this illusion that pain exists there. 100% of the time, pain is a construct of the brain. We can mess with pain really easily without touching the tissues. This is an experiment we did a while ago where we got...
So I just want to say that this construct maybe is better. Construct is better than illusion. 100% of the time, the pain is a construct, meaning made up of different things together to create this experience by the brain. One of the parts of the construct are these messages coming in from different places in the body.
Supposedly normal, healthy volunteers. They're not normal people because they're volunteering for a pain experiment. But let's say they're reasonably normal, right? And we put a very cold piece of metal on the back of their hand. And we just show them one of two lights. One light is red and one light is blue. We don't tell them anything about the lights, we just show them the light. I see that hand. And we ask them, how much does it hurt? And if they see the red light, it hurts more than if they see the blue light. The stimulus is exactly the same. What's different is the meaning of the stimulus. Now there's a cue that says this is really hot because red means hot. So the sensible brain, the clever brain, should say, well, I really don't want you to do it. So I'm going to make it really hurt. These people in the States are allowed to get their psychology students to participate in experiments in exchange for credit points or sex or something. Anyway, they put their head inside what they think is a stimulator for their head. and they make sure that the subject can see the intensity knob. And as they turn up the intensity knob, this picture, the little figure there showing the lines going up at a steady rate, that's their reported head pain, and it matches the intensity knob. But the stimulator's doing nothing. It's just one of those old-fashioned plastic hair dryers that doesn't do anything. Yeah, you know those things? Yeah, you probably use one. Yeah.
One other thing here. So it's like we all kind of know, right, that our interpretation or psychological stress or whatever can make pain worse. But this is actually saying something even deeper, which is that the pain itself, it's not just that it's made worse. It's not just that like we have the physical damage made by, something wrong with the vertebrae in the neck or the back, whatever. And then our how we, our feelings about it or our worries or whatever make it worse. This is saying that the whole thing together is actually a construct. And then the feelings about it and how we think about it, all that, of course, makes it worse too. But it's the whole thing together is a construct.
The trick is that they have to see the intensity knob. And I always think it'd be fun to do an experiment based on that Spinal Tap film where the intensity knob goes up to 11. Remember that film? What's really important from a clinical perspective, and I'm a clinical neuroscientist and I see patients in pain, any piece of credible evidence that they're in danger should change their pain. And they're all walking into hospital departments with models like this on the desk. What does your brain say when it sees a disc that's slipped so far out it's sitting on its own? If you've ever seen a disc in a cadaver, you can't slip the suckers. They're immobile. You can't slip a disc. But that's our language, and it messes with your brain. It cannot not mess with your brain. We can even modulate the location of pain. We can do some groovy.
She looks to me like she's having trouble taking that message in. But I think it's extremely, and I've definitely found this with clients, it's extremely important, like what language we use when we talk about and think about what's going on there, because that's what we believe is happening. If we say it's a slipped disc, if we think that the cause is physical, which is like real, then that interpretation literally sets it in a kind of stone. Because we're seeing, feeling, interpreting, believing it to be something that it isn't, and then that, and it's like the old story about the rope and the snake. If you see a rope and you think it's a snake, then you're going to have a whole body reaction to seeing that mere rope as a snake, and and then in this instance, the message is that the pain is a danger signal. So if we experience something and then we are frightened by it and reify it as something really real, then we're giving the brain a feedback that with our mind we're giving it feedback that it's truly what the brain is afraid that it is, which is something like serious, permanent, real. If we go along with that message and feed it back negative images and thoughts and feelings about it, then that helps to solidify it as something that it isn't. That's the message here.
It's quite well established that referred pain gives you pain in an area of your body that might be physiologically normal, and most of you would have heard of referred pain. Bless you. We do experiments where we give you pain in an artificial limb. Not even yours. This is Meng, who was a postdoc in my lab in Oxford in the UK, and we stole a prosthetic limb, which is a whole other story, which is really funny, but I won't tell it to you. And we can do this manipulation so that you start to feel like the plastic limb in front of you is yours. And we can make the rubber hand hurt. And we can bring in a knife and run the knife across the rubber hand, and you have your brain responses to protect that rubber hand. You're feeling pain in a lump of plastic, effectively. Here's a groovy experiment.
I just want to say that, like, just this one fact, if we really take it in, that we can feel pain in a fake limb in front of us, like using a mirror, so that we think we put this mirror up, and so we're not seeing our actual limb, but we're seeing a fake limb. And then somebody strikes it with a knife and we feel pain in it when we're having no tissue damage, no nothing whatsoever. That's like direct proof, 100%, that the pain is a signal of danger made by the brain. That could not happen. There's no zero physical damage happening. And yet the brain makes pain. So that just shows that the pain is a danger signal. And that's just if one accepts that as true, then it means that all pain has that nature. All pain has this nature of being a danger signal, as being something that the brain makes based on its assessment of what's going on around yourself. So that then is the key. It's like this extraordinary key. Once you know that the pain is actually a danger signal, and it's not from actual, like there's nothing physical in that rubber hand that is at all related to your body in any way. So if you really, if one understands that the brain can do that, that the brain is doing that when it's making pain, that opens up an incredible possibility to learn how to help the brain stop making pain when it doesn't need to. And that's basically what all these, pain reprocessing method, what it's all about.
Experiment where we take two Microsoft clip art people and we put a webcam on the forehead of one of them and a set of virtual reality glasses on the other one. And then we get them to shake hands, and as they're shaking hands, the person on your right, who's wearing the goggles, their visual field is coming from the other person's forehead. Have you got it? So they are effectively looking at the other person thinking it's them because they're shaking hands, the motor command fits, everything's good. And then we come in and put a painful stimulus on that person's arm, and they see it hit the arm of the person over there with whom they're shaking hands. And they say, ouch, it really hurts. We say, where does it hurt? On that man's arm. And they get it right every time. They point exactly where it is, but if you're an outside taking a photo of that, they're literally, we've got the painful stimulus here and they're saying, it hurts there. So the brain is not only producing pain, it's projecting it to this location in midair. We can mess with that. This all becomes really important when pain persists, because two things happen when pain persists that make the life of someone in pain really difficult, that cost our country $40 billion a year, cost Australia more than cancer, cardiovascular disease and diabetes combined. Thanks for that facial expression. I wanted someone to go. This is the problem, that if we keep running the neurons, the brain cells that produce pain, they get better at producing pain. They become more and more sensitive, so we need a smaller and smaller influence. The illusion, if you like, in increasing sensitivity becomes very unhelpful. It's trying to protect you from something that's not needing protection. It's very real. The other thing that happens is that all of these networks lose their capacity to be specific and precise. So the pain spreads. The pain changes its quality. Ultimately, it's not even informative. It's both unhelpful and uninformative. Maybe the next TED Talk ever is the really important question, what do we do about it? Who knows? But no, we do know. That's what we're really researching, but that's the end of my 18 minutes. Thank you very much for having me. It was cool.
All right, so hopefully that was interesting. And I want to show this just to kind of like a little visual that might give a sense of like what the pain actually is. This just shows different centers in the brain. And this is I think it's pretty accurate actually where some of these centers are. I think there's like 16 or so different centers that together through feedback mechanisms, kind of make a judgment call about what's going on, and then send a message. And when you have chronic pain, what happens over time is that, because, as he said, neurons that fire together wire together, the brain gets better at. It's a learning. It's just like anything you learn, riding a bike, anything that you do. You grow a groove. The brain gets better at doing the thing that it's doing. So if you've got these centers that are creating pain, over time, they can, they become sensitized. That's a good way to think about it. They become sensitized, as if you turn the gain up on a microphone. It's very much that way. Like now it's louder because I didn't turn the gain up, but my voice is louder as if I turned the gain up. Okay, and then now they're just showing one way to reduce the by adding GABA, another neurotransmitter, a way to reduce this pain. And so if pain is calmed, if the brain sensitivity process is calmed by other neurotransmitters, the question then is how do you get those facilitate those other neurotransmitters to be released or to calm those areas? How do you teach the brain to stop, to actually begin to pacify the pain that's being created, and learn instead to produce other sensations or no unnecessary pain sensations, which is essentially what these methods and mind-body methods are about. Is once the door is open, because you no longer believe that it's a physical thing so much, then the door is open to start to do things that actually calm the hypervigilance of the nervous system and of the brain, this hypersensitivity that's creating this pain. But there's something I want to show you that is this physicist talks about this kind of hypersensitivity of the brain. I think is useful to have a kind of a clear image of what's going on there.
Hi, I'm Paul Hansman, inventor and physicist at UCSB and Active Life Scientific, and former chronic pain sufferer. Physicists love to build models. This one can help you understand the key to overcoming chronic pain. During normal activities, the sensors in our body send small signals, as when I squeeze this wrist. These small signals will not cause pain. If the signals increase, like for a hand in a vise, these large signals travel up the spinal cord to the brain. The brain creates the experience of pain by activating pain areas indicated by these lights. The brain creates the experience of pain to help you. In this case, help you know not to tighten the vise too much. When the signals are reduced, the pain goes away. This is as it should be.
And I just wanted to add there that this is also, you may have, if somebody, say they're working out or they do something, they do something that at first cause a little pain or stress or something like that, they can, if they keep working in that area, they can essentially teach the brain that force isn't dangerous, that level of distress also is not dangerous, and the brain will stop making pain about it. So they're kind of decreasing their sensitization to that level of stress in the body. But what happens with chronic pain is that he'll show you what happens.
If, however, the brain continues to generate the experience of pain for 3 months or more, the brain gets good at it. Just like learning to ride a bike. Neurons that fire together wire together. Sensitization increases. With increased sensitization, just doing normal activities can cause intense pain because sensitization is like a volume control for pain. The problem is not the normal activities. The problem is sensitization. You can take pills or injections of opioids to make the pain go away, but of course, the pain comes back, eventually worse.
And this is something that this sensitization is something that you might know very well from tinnitus. I know from tinnitus. When I had that, and it still comes to me sometimes, but when I had that, I became super sensitive to it for a while, and it was horrible. As I learned to not be so sensitive to it, to not be so alarmed by it, how loud it was decreased, and how often I was disturbed by it really much decreased, so that I'm rarely disturbed by it now. It's a really similar process on what can happen with tinnitus and what can happen with chronic pain.
If you keep taking them, the opioids can further increase sensitization. At this point, you might be tempted to keep trying therapies for your body, because that is where you feel the pain. But the pain is there even for no signal from the body. The problem is not the body. The problem is sensitization.
I just want to pause it again, like that. This is so important what he's showing here, that the pain is not there in the hand. It keeps feeling to the person. It keeps feeling to the person that the pain is, even when it keeps getting worse, like chronic pain, it keeps feeling more and more. It's even more pain in the same place, in the back, or fibromyalgia over the whole body, whatever. It keeps feeling like the pain never tells you that it's coming from the brain. It will never tell you that. You can't get to it that way. The pain will keep telling you that it's real. But if you understand, as he's showing here, that the sensitization is happening here, then that gives you a way in to begin to do things to calm the sensitization here without caring so much about what you're feeling in the body. It doesn't mean that the pain isn't real. You're still feeling it that way, but you just change your focus from, okay, I've got to do something about that in my spine, my vertebrae. Instead, your focus changes to, okay, I've got to do something about the oversensitization happening in my brain.
The key to overcoming chronic pain is reducing sensitization. The key to overcoming chronic pain is reducing sensitization. You can pause this slide and the next to find techniques for reducing sensitization: learning, activity, biofeedback, guided imagery, and meditation.
Just want to go back for a moment. So the learning is actually what this is, right? What we're doing is taking on a new view and investigating it for yourself about whether it's true, like investigating what pain is, how it functions, and coming to some conclusions about it for yourself. And I want to mention there that almost nobody believes this new view 100% right from the start. There are people who read one of John Sarno's books and had an immediate cure. They had back pain for 20 years or whatever, and they were so convinced by this presentation by the doctor that it hit them so deeply that this was not in the tissue, that it was actually, in this case, that they saw it as unconscious rage. That there's but it's similar in that there's a unconscious stress in the nervous system that's coming out as the pain. But generally speaking, they say a person, it's often the case that a person only fully believes that it's actually being made by the brain when it's completely gone. Once it's completely gone, because of work a person's done to retrain their nervous system, essentially, to retrain how they're focusing on, how they're being with, how they're feeling the pain, then it really hits home. It is, they can feel totally, okay, yeah, that really is, it really was, you could say mind made, brain made. Until then, it's always going to feel like, because our habit is so deep, it's going to feel like the pain is coming from that location in the back or in the neck, rather than coming from here. Because that's how, that's just how it feels like to an animal, just naturally, and that's how it's supposed to feel. If we were animals and we ignored, the signals of pain, we would not be here. It was absolutely, totally right, evolutionarily, for us to believe that the pain was 100% real, coming from wherever it's coming from.
Sensitization, learning, activity, biofeedback, guided imagery, and meditation. I encourage you, if you are in chronic pain, you can greatly diminish or totally overcome it. Thank you.
So I think that's that's a really nice, hopeful message he has there too. And I've heard lots of people who have that. Sorry about that. There's been a lot of people who've experienced that they totally overcome their pain. I would say, for me, my practice now is to be basically outcome independent, which means, sometimes I still have some pain in my neck, but I simply don't feel it the way I used to. And if I have it sometimes, I had this brain habit for a long time. It just doesn't feel, I'm not distressed about it the way it used to be. And it doesn't stay around like it used to be either. So the whole environment in which the pain that I have comes and goes is just different than the way it was. So I don't really care if I feel that pain now. Something, I will massage it sometimes or do something, but often I'll just track it somatically. I'll just notice it and notice how it's changing, and not, and I just experience it in a different way. But what I hope for you is that, like, if you've got some back pain now, that you could become, that you could be completely free of it. And a lot of people become completely free, like 100%. People that work on this stuff. So it's not impossible at all to become totally free of chronic pain. And I think along the way, one last thing I'd want to say is that, I think some people, like, they give up totally, like things like chiropractic or physical therapy or whatever else they might be doing, because because it can be like, if you do those treatments that are focused on the idea that it's an outer problem rather than a brain-based problem, at some level you're giving yourself feedback that you're buying into the idea that it is that the culprit, you could say, is someplace in your spine or your neck, or whatever. But it's also the case that things like that, if you have they do have positive effects. Like what I think is going on. Like if you have a chiropractic adjustment, you're getting a new set of signals and sensations from your body to your brain. And if there may be some tightness because your vertebrae are in one particular way, and when you have different sensations coming up from from your body, your brain may not make pain sensations or pain signals from the new set of sensations. So it's fine, and it's common to get some kind of temporary relief from all these things. Like we wouldn't do them if we didn't have some relief. Same thing with like cold, cold or breathing processes. There's a whole flood of endorphins and chemicals that we can flood the body with that will take away the pain, the pain sensations for periods of time, and that's great. I don't feel like that there's some reason necessarily to stop any of those things, but I think that the main focus and understanding of the treatment can gradually become that you're learning how to decrease, you could say, decrease the stress, hypervigilance, fear within your nervous system as a whole. And then especially the stress, like the fear, the distress about those pain sensations. That's what you're, what one works on with this method. And by doing that, what we find is that the pain starts to decrease, because you're not feeding it this, you're not giving it this feedback that, oh yeah, it really is real, it really is serious, it really is problematic. Instead, you're giving a feedback that actually that those sensations are safe. They may not feel safe at the moment, but actually I'm feeling them as safe, and I'm the way I think about them is that actually it's okay. It's just, being made by my brain. It's just an illusion. And this kind of way of using your mind to work with the sensations you're feeling is what gradually decreases the vigilance and fear that's kind of latent within the nervous system. And that's healing over time. It has been for me, and it's that way for my clients too. So I don't know, man. Just a different view on what's going on when we have pain, and hopefully it's like I don't know if it's like I made a compelling case or not, but that is it's what's worked for me and what I see working for other people too, and might be something useful for you if you want. But it's completely up to you and what makes sense to you. So I hope anyway that it was interesting, and also maybe a little window into some of the work that I'm doing, which is first helping people kind of understand the pain in this way, and then working on methods to actually, once one have this understanding, to begin to see and feel the pain through a lens of safety, or feeling like it's actually it's okay, which strangely enough then starts to decrease the pain. So hopefully that wasn't too long, and so take care, buddy, and I'll talk to you sometime soon, I'm sure. All right, later.